Next one is from Rochelle Dobson.
Mr. Hockey, I've taken the liberty of doing some maths. I have friends who are in their mid-20s, they're married with 3 young children. Let's say that all those 3 young children all become ill at the same time. Under the proposed $7 co-payment plan, it will cost them the following. $7 for a doctor's visit, times that by 3, that's $21. Maybe the children have whooping cough, that's determined by a blood test, another $21, which gives us a running total of $42. A follow-up trip to the doctors, another $21, which provides us with a running total of $63. Add the cost of medicine, and I'm sure many here in the audience would agree that the cost of all this becomes colossal. Mr. Hockey, how does a young family who live paycheck to paycheck afford this unplanned expense under the proposed plan?
Well, I recognise it is. I recognise it is hard. Can we talk about that co-contribution for a moment? We thought very carefully about the growth trajectory over the medium term in the Medicare system. Bob Hawke in 1991 tried to introduce a co-payment of $3.50, which is roughly just over $6 now. He legislated it, in fact, and did go down that path, and then he was rolled by Paul Keating and it changed. But the bottom line was, when he introduced it, he said Medicare would not be sustainable, and at that time Australians visited the doctor on average 4 times a year.
But can I just say,
now Australians visit doctors on average 11 times a year. 11 times a year. Every dollar that is contributed either goes to the doctor, which is $2, or $5 goes into a medical research fund. So it stays in the health system.
Okay, it doesn't stay in the health system in terms of the budget though, does it? I mean,
yes, it does.
If this was in response to a budget emergency, you wouldn't put it into a fund that might appreciate money over 20 years.
Well, no, I'll tell you why it is important to put it into medical research. Because if we are truly going to find the cures for cancer, mental health illnesses, Alzheimer's and so on, we've got to start investing now. And medical research is a great strength of Australia. We're very, very good at it. So every single dollar of savings, including the co-payment, goes into the Health and Medical Research Fund, that fund.
Mr. Hockey, the questioner wants to get back in there.
Mr. Hockey, I understand that medical research is important, but as you explained to the previous questioner, you come from a background that wasn't very privileged. How do you propose that people who live paycheck to paycheck and aren't earning very much money here in the Western Sydney area, how can they afford a total of $63 if, you know, that's a food budget, that's petrol for the week? How do you propose, it's not planned. How can you plan that your children are sick?
There are a number of concessions available. For example, for children under 16 after 10 visits, it's free going forward. Secondly, if there is a situation like that, the doctor has the discretion not to charge in an extraordinary circumstance. That's one of the reasons why of the $7, we're giving $2 to the doctors. So that is an extraordinary situation, all 3 children being hit at once, short period of time. Clearly, look,
it sounds like the question is...
I actually do have 3 children. I know they can be hit at one time. But having said that, it can be an extraordinary situation that the doctor has the capacity to identify. Also, if any of them are on a chronic health plan, then they are not going to be charged the $7. So as it stands, as you point out, if they go to get medication, they also have a PBS co-payment, which is something Labor introduced in 1990 and which has continued to help to make the pharmaceutical benefit scheme sustainable.
Just a very quick question on that. This co-payment you've agreed is effectively a tax on people going to the doctor. Is that a broken promise, since you said there would be no taxes without an election?
Well, I don't accept. It's a payment. Well, you can call it a tax.
You
can call it whatever you want.
You admitted it was a tax.
No, I didn't actually. And the fact is, you know, it is a payment. It comes out of a pocket. It comes out of someone's pocket, a taxpayer's pocket.
Effectively a tax.
Well, whatever you want, Tony. Given that
So
Given of the $7, $2 goes to the doctor. I don't know doctors in that situation were receiving taxes. But your call, you want to call it a tax, you can call it anything you want. You can call it a rabbit. I don't mind. You can call it whatever you want. But it's a tax.
the question is, if it's a tax, as you seem to agree that it actually is, then is it a broken promise when you said you wouldn't raise any taxes without
Well,
going to an election?
we didn't say we wouldn't raise any taxes. That's absurd because we went to the last election promising to introduce a levy for the paid parental leave scheme. We said emphatically that taxes would be lower under us than they are under Labor, and if you have a look at the budget papers, it actually shows that taxes under us are lower than if Labor was re-elected.
Okay, we're going to go to we've got a few people with their hands up. We'll try to get to some of those, but in the meantime, which is Maureen Gildart.
Mr Hockey, many pensioners have worked all their lives and paid tax in order to receive the pension and Medicare. Would you please reconsider the Medicare co-payment for pensioners, as if they've got 2 or 3 visits a week and it's off pension week, that can be only up to $21, and if they're only going to get $765 a fortnight, that's a hell of a lot of money, and many of them won't be able to afford it. One elderly pensioner said to me that she would have to stay home and die because she couldn't afford 3 visits a week to the doctors and for a blood test. And also, you give the pensioners $6 a fortnight in a pharmaceutical allowance. Seeing you're putting up the cost of scraps to 80 cents for pensioners, will you please increase the pharmaceutical allowance for these people?
Look, I'll have a look at that second issue that you raised. In relation to the first issue, after 3 weeks, that pensioner wouldn't have to pay, because for a pensioner, there's 10 visits to the doctor a year where they have the co-payment, and after that, there's no co-payment, it's free. So it wouldn't be three visits a week every week of the year. It would be a total of 10 visits a year that they'd contribute, and after that, it'd be free.
Okay, I'm going to go to another pensioner over here on the right-hand side, Ron Bloom, on the left-hand side, I should say. Ron Bloom. Where's Ron? Oh, sorry, I beg your pardon, wrong side.
You've stated compare the $7 co-payment to beer and cigarettes. As an age pensioner, I can't afford beer and cigarettes. I might give away an ice cream, but that's my pleasure. So I just wondered why you mentioned that. Even a $1 co-payment on Medicare is a slur on the Medicare system as it was originally produced. Medicare has always been a free for all Australians, and I think it should continue to be so. I don't think pensioners should have to pay that.
Is that a comment? Well, Medicare hasn't been free. Medicare is paid for by taxpayers, so it's not free. There are some Australians who do get free services from the doctor under the bulk billing arrangements that exist, free bulk billing. But many Australians actually pay to visit a doctor. Most Australians, if not all Australians, pay for their pharmaceuticals. And certainly, at the end of the day, Australians do contribute with the Medicare levy towards Medicare, even though it goes nowhere near raising the amount of money that Medicare costs. I just say to you, sir, we want it to be sustainable in the future. We really do want Medicare to be sustainable in the future. A co-payment in this sort of situation does not undermine universal health care as suggested by others. The World Health Organisation recognised that you can have a co-contribution in relation to this. It's when the co-contribution prohibits someone from going to visit a doctor. That's why we have built-in safety nets, including giving the doctors 2 of the $7, which allows them still to collect some money from the government and use their discretion to ensure that someone who cannot afford to pay does not have to pay.
Wouldn't the logic of that argument make much more sense if the money from the co-payment actually went back into the Medicare system? In other words, went back into the health budget.
But it actually does. If we do not find the cures, if we cannot help to find the cures, for dementia and Alzheimer and mental health and cancer, then the system is going to blow out in costs over time.
Let's go,
But
back,
having
well,
said
let's
that-
go back to someone who has to face this issue now. Ron Bloom, you've heard the argument. Do you accept it?
Well, the beginning of my question was regarding the fact you were saying give away a couple of beers or give away a packet of cigarettes to pay for your doctor, where that doesn't really apply to people, pensioners generally, I would say. I don't think any of us can afford to smoke. It's too expensive.
I understand that, and in many cases that may well be the case. 80% of people over the age of 65 are on the pension. 80% of people over the age of 65 in Australia are on the pension.
Is that the number of people you've scared with this budget?
Tony, I'll take that as a comment.
Okay. We'll go to Thomas Jenkins. We've got a question from Thomas Jenkins on the same subject.
Has increased welfare, particularly middle-class welfare, in the 90s and 2000s, destroyed our aspirational culture and drive? Has it also conditioned Australians to a lifestyle of government dependency rather than self-reliance?
I hope not. I really hope not. The welfare, we're spending more on welfare now than we spend on healthcare at a federal level. I mean, we're spending more on welfare than we spend on the education of our children. We're spending more on welfare than we spend on the defence of the nation. It is by far our single biggest area of expenditure. Now, it's got to be a safety net, not a cargo net. And the danger is that people fall into a trap of relying on welfare. And we've all got to work together to make the welfare system sustainable, but particularly, and in some cases we're going to have to increase support to ensure that those most vulnerable actually get the right help and support. So everything we are doing is about trying to make the system more sustainable into the future. That is hard, and it's not going to be easy. And it's got to be a partnership, a compact between the community and the government, whether it's Liberal or Labor. I mean, let's be fair dinkum. You know, Labor took over 60,000 single mums off a pension and put them on a Newstart. And we supported that, right? But it was a difficult measure. I don't want to be in a position where we're making harder decisions down the track, which are more punitive, because the welfare system is not sustainable.
The question of specifically asked about middle-class welfare and talked about the period of the Howard government. You've talked about there being too much middle-class welfare effectively during that time. Now, on the issue of families, John Howard says your changes to tax benefit Part B are in effect a tax increase. Another tax
I don't think
increase.
he actually said that.
I think he did.
I don't think he did. I don't think he did. He didn't use those words.
He said these are not government handouts, as you've sort of implied, but actually tax concessions.
All right, okay, that's a little different. The fact is that in relation to...
He certainly counselled you not to do it.
Well, you know, Tony, I mean, I'm the one that has to put the numbers together. And I love and admire John Howard. I was in his cabinet and... he's a very good and decent man. And he made decisions in 1996 with Peter Costello that set up the budget. He also had the benefit of rising terms of trade, falling unemployment, which he helped to create. We now have falling terms of trade and rising unemployment. And we've got deficits as far as the eye can see. We have to fix the budget. Otherwise, nothing is sustainable in its current form. And we are determined to fix the budget. And I know that is hard, but if we don't do it, the pain associated with fixing the budget is going to be far greater in the future than it is now.
Thank you. Let's go to our next question from Corey Gunnis.
Hi, Mr. Hockey. I live with rheumatoid arthritis, cerebral palsy, osteoporosis, osteoarthritis, chronic asthma, hearing loss, an anxiety disorder, and clinical depression, regularly requiring 12 prescription medications per day, a hearing aid, regular GP and specialist visits, care at home and requiring regular scans and blood tests, and very soon a major invasive surgery on my bladder. How do you expect me to live on a disability support pension and treat my conditions when I cannot find suitable work with your proposed heartless Medicare co-payments and other increased cost of living measures?
Well, from what you said, you wouldn't be hit by the so-called Medicare co-payment. You wouldn't be affected.
Initially, I would.
No, you wouldn't, because you'd be on a care plan with your doctor. Obviously, you've got a number of chronic diseases. In that situation, you are not affected by the co-payment. So it does not affect you. And
I'm just going to go back to Corey Gunnis, seems to have a different opinion on that, so let's hear
Yeah,
from him.
there'll be many other increases in cost of living with fuel excise. That's going to increase goods and services as well that will be passed on through the cost of living.
And the abolition of the carbon tax, which is going to reduce household costs by $550 a year, and tax cuts overall, which we're delivering without the carbon tax. Our overall tax take is actually less than it would have been. Therefore, the impact on cost of living is less than would have been the case if we weren't elected. In relation to the fuel excise, it is going to be 1 cent a litre, 1 cent a litre in the first instance. That money that's 40, 60 cents to fill a Camry. It'll be 60 cents extra in fuel excise. That money is going directly into road building, road upgrades around Australia, which are essential. For example, to go from here to the city, with our investment in new roads, we removed 43 sets of lights, of traffic lights between here, Penrith and the city. So we have to invest. The amount of money we are raising from the increase in the fuel excise, which by law is going straight into the road funding program, the amount of money we raise is a fraction of what we're about to spend on roads.
Briefly, do you accept that that's another tax increase that you didn't tell people about?
It is a tax increase. Sure, it's a tax increase.
So when you said no new taxes, they get new taxes?
Well, it is a tax increase. Yes, it is a tax increase. And again, I say to you, our commitment was that taxes would be lower under us than under Labor. And as the budget papers show, they are lower as a result of our decisions than they were under Labor.
I mean, people are also taking the Prime Minister at his word on some of the things that he said about this, and he was very specific, saying no new taxes without going to an election.
Righto. Well, Tony, we're arguing the politics of it, and I accept where you're coming from.
We're arguing what people said. Who are now in power.
Okay, if we're arguing what people said, gee whiz, I wish the other mob had told us how bad the budget was. I really do.
All right. We've got another question. It's on a similar subject from Kerry Rogers.
Mr. Hockey, I'm a registered nurse who lives and works in the area. You've managed to achieve something that I didn't think was ever going to be possible. You've managed to galvanise every sector of the healthcare sector against your co-payment. The AMA, the Doctors Reform Society, the ANMF, medical and nursing leaders, health economists are all opposed to your co-payment. This affects those with chronic and complex care needs the most, and it affects those with the least ability to pay. It's unfair in the extreme. These people will delay presenting for treatment to their GPs because they can't afford the co-payment. They'll end up in our emergency departments and may then need to be admitted to our hospitals, which is a much higher cost to the entire system, let alone the cost to those individuals physically and emotionally. This is absolute madness. This attack on Medicare and universal health care is driven by liberal ideology, not necessity. How can you justify a $7 co-payment when we're only spending 9% of GDP on our healthcare system, less than half of the USA?
Ma'am, I understand what you're saying and I respect where you're coming from. Do you think the United States has a better health system than Australia?
No.
Okay, well, they're spending
where you're
twice.
driving us.
They're spending twice the amount that we're spending, and they haven't got a better system. And I share that view with you. But the challenge is, ma'am, how do we make sure that the health system we have gets better and better over time? That's the question we face. And at the end of the day, someone has to pay for it. It's always the taxpayers. Someone has to pay for it. Now, what we have to do is when we have projects like this or initiatives like this, we have to ensure that those most vulnerable and those most exposed have an appropriate safety net. And that is what we've actually done by having, of the $7, again, $2 going to the doctors so that they can then determine if someone is in real trouble, and they will obviously not charge. Secondly, it's only 10 visits a year for anyone under the age of 16 or a concession card holder, which is millions of Australians. And thirdly, if you have a chronic disease or some serious affliction that is being managed by the doctor, you will not have to pay the co-payment.
I'll quickly go back to our questioner who's on her feet.
I say to you that our healthcare system is one of the best in the world. We have been judged by Bloomberg as being the 7th most efficient healthcare system in the world. We have a world-class healthcare system. You are trying to destroy that system.
I don't accept that.
People will not be able to pay 10 visits a year at $7 a co-payment is far too much for people to pay. I don't think you've heard a number of people in the audience tonight tell you that they cannot afford in a fortnight. That's the difference between someone putting bread and milk on the table for their children or going to the doctor. These are the choices your government is forcing people into.
Okay, we're going to take that as a comment.